Hi, this is Dr. Moran, and I'm going to talk to you guys today about vertigo. Nearly 40% of U.S. adults experience vertigo in one time of their life. It could be anywhere from a minor nuisance to completely wreck somebody's life. You know, we've seen many people with it, and usually they have to be driven here to the office because driving and most normal everyday activities are very difficult to perform. When people say they have vertigo, usually they say they feel dizzy, sometimes they feel like the room is spinning around them. Kind of like when you're spun around, I'm not sure if you remember as a kid going on an amusement park ride, you just get spun around, you feel dizzy afterwards, and usually it'll go away, but sometimes, people will feel this way for a few hours, or sometimes it can last for months or years. And some of the other symptoms of vertigo, there's lots of different symptoms that can occur. Some of these include things like blurred vision, you have difficulty focusing, problems hearing, especially if it's out of one ear. You can have ringing in your ears, trouble maintaining balance, difficulty concentrating, feeling fatigued, feeling tired all the time, feeling nauseous with no real explanation for it, feeling like you have seasickness. You might even have things like slurred speech or double vision. So these are some of the symptoms that can occur, and there's some known causes of vertigo, and there are a few that can be treated in our office. The most common cause of vertigo that we treat in our office comes from migraines or tension headaches that are caused by injury in the neck or upper back. So if we look here, here's your neck. This poor posture can also result in this. So let's say you have a misalignment in your neck, moves out of alignment, causes pressure on that nerve, and it affects the nerves going up to the head, causes muscle spasm, causes headaches, migraines, and it leads to vertigo. Like when you have misalignments in the neck, upper back, basically what it does is it stresses out your nervous system, and it causes a kind of short circuit, and they can lead to many symptoms, including vertigo. One thing to remember is if you have headaches, migraines, or vertigo, it's best to look at what's causing the problem rather than taking a medication for the pain that'll cover up the symptoms. I say pain is like the check engine light for your body, and when you take some for the pain, it's like driving around with a check engine light. Most likely you're going to be okay, but you could be causing long-term damage to your body or also your car if you're driving around with a check engine light. And so that's the first cause, is problems in the neck, posture. The next cause of vertigo that we see are problems with the inner ear, especially with the inner ear crystals. Your body uses a complex system in your ear to give you balance, and when there's an issue with that, vertigo is a very common symptom. There's a few techniques to correct this, and we have performed this on many patients with a very high success rate. When we see vertigo here at our office, first thing we do is get you in, I perform an exam. It gives me a good idea of what's causing the problem, and then from there we take some x-rays, and we're able to figure out where the problem's at, and we come up with a game plan to get rid of it after we look at your exam findings and x-ray. Now, one thing important here is if you have vertigo, one thing to note is that some of the symptoms of vertigo can be similar to that of a stroke. So it's best to get it checked out as soon as you can, and if you think you're having a stroke, head to the emergency room as quickly as you can. So just to summarize, vertigo is very common. It's either caused by a neck issue that causes headaches and migraines, or an inner ear issue. Those are the ones we can treat here. It can cause lots of problems in your life when you have it really bad, and those are things that we deal with in our office. If you have any questions, give us a call, leave a comment, and we'll get back to you as soon as we can.